With an update on our COVID-19 numbers. As of today, we have had 1,028,131 cases, 1,434 new cases reported since yesterday, 694 people in the hospital, and sadly, 13,550 people who've died. Fueled by the Delta variant, we've seen a recent increase in cases, percent positives, and hospitalizations. We pray for those who are sick, the people we've lost, and the ones that they've left behind. The best way to combat this pandemic is with vaccines. And in positive news, we've hit a new milestone today. 60% of North Carolina adults 18 and over have received at least one dose of the vaccine. That's good. This summer, it's been uplifting to see so many people getting back to the things they love to do, hugging their grandkids, taking vacations, gathering with friends, going to sporting events, visiting their favorite local shops in person. Vaccinations are making this possible. While this disease is still with us, the more people get vaccinated, the less it has to affect our day-to-day lives. Thanks to safe and effective vaccines that are free and everywhere, North Carolina has entered a new phase of this pandemic. This new phase is marked by a laser focus on getting as many people vaccinated as possible. It will literally save their lives. The vast majority of the new cases and hospitalizations are among those who have not been vaccinated. It's clear that these vaccines work, and they're our best weapon to fight COVID-19 and the variants. For our part, the state of North Carolina, in partnership with healthcare providers, community groups, and faith organizations, will keep pulling out all the stops to get more people vaccinated. I've been able to visit vaccine sites all across our state, and I'm grateful for the staff and volunteers who are making it easy to get vaccinated. In some places, you don't even have to get out of your car to get a shot. As we enter this new phase, the current executive order will expire at the end of the month. Although we will no longer have a statewide mask mandate, we expect people to be smart, follow public health guidance, and do what works. And today we are releasing strong protocols for schools as they plan for the year ahead. Local school districts should continue to protect students and staff by requiring masks and testing as outlined in the guidance that Dr. Mandy Cohen will be explaining in a minute. The most important work our state will do next month is getting all of our children back into classrooms safely for in-person learning. That's the best way for them to learn. And we want their school days to be as close to normal as possible, especially after the year of disruption they just had. But many students can't get their shots because children under 12 can't be vaccinated yet. We all need to work together to keep our younger children in the classroom and safe. One way to protect them is to get vaccinated yourself. If you're eligible and you get your first shot today, you can be fully protected by the start of the school year and less likely to infect your child. We also know from extensive research that the spread of COVID-19 in schools last year was low because students and staff wore masks. The guidance in the toolkit strongly states that schools should require masks indoors for everyone, students and teachers, in kindergarten through 8th grade. It also directs schools to ensure unvaccinated high school students and teachers wear masks indoors. Studies have shown that masks can slow the spread of this virus among those who are unvaccinated. That hasn't changed. We know masks work. The health and safety and ability of our students to learn in person depends on school leaders following this guidance. Unfortunately, we've seen our statewide numbers on cases and hospitalizations on the rise over the last 3 weeks. This pandemic is not behind us yet. We will continue listening to experts as we share health recommendations and the tools that people need to stay safe. And if the pandemic worsens and additional action is necessary, we'll take it. The best way to stop this disease from spreading and keeping our numbers down is to get more people vaccinated. And we have made so much progress against this virus, and now is not the time to ignore it. Even if you have been vaccinated, take it upon yourself to encourage others to get a shot. I'm confident that we can clear whatever hurdles remain and emerge from this pandemic stronger than before. Now I'd like to ask Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services, to provide more information about the public health direction being given to our schools. Dr. Cohen.
Thank you, Governor. As we head into a new school year, our North Star remains keeping students in classrooms. We have learned so much about how to keep our kids learning in person and doing it safely. Today, we're releasing an updated Strong Schools Public Health Toolkit aligned with both CDC and the American Academy of Pediatrics guidance, both which urge that everything possible be done to keep students in the classroom. They emphasize that with proper safety prevention measures, the benefits of in-person school outweigh the risks in almost all circumstances. The best COVID protection measure we have is vaccination. Vaccines provide protection from serious illness, COVID-19 related hospitalizations and death, as well as complications from the virus. Rigorous clinical trials among thousands of people ages 12 and older have proven that vaccines are safe and effective, and more than 160 million Americans have been safely vaccinated. However, with only 24% of North Carolinians ages 12 to 17 fully vaccinated, and because anyone under the age of 12 cannot be vaccinated yet, we still have a long way to go. Schools need to use the additional safety protocols outlined in the Strong Schools NC Public Health Toolkit to continue to protect students and staff as we enter the new school year. As the governor said, the toolkit says all schools for kindergarten through 8th grade should require all children and staff to wear masks indoors, regardless of vaccination status. For schools in 9th through 12th grades, schools should ensure that anyone who isn't fully vaccinated, including students, wear a mask indoors. We've also updated quarantine guidance so that we can keep students in school whenever possible, particularly when proper prevention measures like vaccines and masks are used. Anyone who is fully vaccinated and does not have symptoms does not have to quarantine after a close contact with someone who has COVID-19. In addition, unvaccinated students do not have to quarantine after close contact if students were appropriately and consistently wearing masks. The toolkit includes additional measures for schools related to physical distancing, which we've reduced to 3 feet whenever possible. Testing, which is being provided free to schools for students and staff with symptoms, as well as testing for screening. Transportation guidance, cleaning, and other considerations are in the toolkit. Importantly, we also took out a number of protocols we now know through scientific research that don't have benefit so that schools can really focus on the things that work. The updated toolkit reflects the expertise of the CDC, the American Academy of Pediatrics, and our public health experts on how to keep our kids in person and safe in schools with layered prevention strategies. It is important to note that the need for additional statewide action and changes to the toolkit may be needed over time as we receive new data, watch our COVID trends, and hopefully see vaccinations become available for children under the age of 12 later this year. School leaders should continue to consult with local public health officials for input to make local decisions. Now, as a mom of 2 elementary age students who are too young to be vaccinated and also attend the Wake County Public Schools, I know how hard our educators and school staff have been working. I want to thank North Carolina superintendents, their educators, and school staff who have worked tirelessly throughout the pandemic to keep children safe and learning. One way we can all show our thanks is doing everything we can to end this pandemic. That means get vaccinated right now if you haven't. We are seeing the impact of the very contagious Delta variant COVID-19, and it's hitting those who are unvaccinated very hard. Cases are up, hospitalizations are up, the percent of tests that are positive are up, and we know that even people who have a mild case of COVID-19 may struggle with long-term effects like shortness of breath or chest pain and brain fog. Now, this moment is different than the last time we experienced rising trends. Now, vaccines are widely available across the state, and 60% of North Carolina adults have received at least one dose. We also know 94% of the cases and hospitalizations we have now are in people who are not vaccinated.